Ladies and gentlemen, in the United Arab Emirates, folks pride themselves on innovation, on excellence, and on bringing the future into the present.
Now imagine this. What if every household in the UAE could access a doctor instantly?
Not through waiting rooms, not through long drives, but right at home. Imagine a home device that could check vitals, heart and lung sounds, examine the ear, nose, and throat, even record an ECG, Harif, and have a doctor review everything in real time. A device that transforms remote care.
And to introduce this innovation, the future of home health, please welcome the medical mind behind it, Dr. Lavagnan.
Thank you, ladies, for the wonderful introduction. Now, thanks again, and let me take over. Hello, ladies and gentlemen. Let us talk about telemedicine. I've spent almost 25 years working in remote areas, setting up telemedicine centers, and let me tell you, telemedicine is a very powerful tool for a doctor because he can use it to connect to remote patients and provide advice and healthcare. Now, I personally feel that telemedicine has not been exploited as much as it could have been, and there's a huge opportunity waiting for people, for doctors, in the cities where you have thousands and thousands of families who could use the convenience of telemedicine. Of course, today, when we talk of telemedicine, people mostly think it is video conferencing. You switch on your WhatsApp or maybe Zoom, you talk to a doctor, and he sorts of advises you and perhaps gives you some kind of over-the-counter medication. But that's not really telemedicine. In real telemedicine, we use remote tools like electronic stethoscopes with which you can listen to the heart, you can listen to the lungs, you can listen to the abdominal sounds, and then you can use devices through which you can look at the eyes, the nose, the ears, the throat, and so on and so forth. So by using a large number of devices like this, you can also see vitals, like for example, pulse, temperature, blood pressure, respiration, and so on and so forth. Now, when you as a doctor have those kinds of inputs, that is when you feel confident to be able to prescribe more thoroughly because you now have a definitive diagnosis thanks to all these instrumentations. So, what if each family could have this set of devices? I mean, a family just sits at home and they can connect to a doctor at their convenience, get themselves diagnosed without leaving the comfort of their home. Okay, that sounds good. But there's an issue out here. Number one, how do you expect a person to use all these instruments, this array of instruments which are pretty complicated? Okay, so it's not exactly very complicated to use. However, you need some kind of training. So, how about the way we do it in the villages in India? We pick up a person from the village. He need not be highly qualified. He needs to be intelligent. He needs to be eager to learn. And then it becomes very easy to teach them how to use all these instruments and things like even the ECG monitor, the ECG devices, and so on and so forth. Once that is done, what we do in the villages is that the person goes to a village, looks at the patients, connects them up to the doctor, and helps the doctor by being literally the doctor's eyes and ears. He places a stethoscope where the doctor wants it placed, the electronic stethoscope, of course, and puts the otoscope, the electronic otoscope, into the patient's ears, and so on and so forth. So the doctor can really diagnose well. That's good. But how do you do it in cities? So here's the what if. What if we create a special device which had all these instruments in it? What if we picked up gig workers? Gig workers are very, very fast, very intelligent. What if these people could reach a patient's home in 10 minutes, half an hour, even 1 hour, and then set up all the instrumentation, connect the patient up, and allow the doctor to really see the patient using those components, look at his heart rate and so on and so forth, and give a good diagnosis. And he generates an e-prescription which can then be sent to the nearest pharmacy, and the drugs are also delivered at home. Let me tell you, if you had this kind of a setup, then a doctor sitting remotely can treat almost, I would say, around 60 to 70% of cases, normal primary care cases. He can also take care of preventive care. He can also take care of chronic cases. I mean, an old person who's got, say, hypertension, that's blood pressure, he doesn't have to trek all the way to the doctor just to be seen for 2 minutes and then told, okay, you continue with the same medications, you're fine, or perhaps you increase the medication. All of this is possible, and this is what we are trying to do. We want to test this concept where we use our gig workers, trained gig workers, to go to patients' homes. That means each family can have this kind of a person going home, connecting to the doctor. The doctor examines the patient using all those advanced tools that are there. And remember, only one set is required per gig worker who can see literally hundreds of patients, right, in a couple of days. Now imagine that kind of convenience. Don't you think that it's going to be really useful for the patient and the doctor? Yes, we think it would be. And that's the reason we are reaching out for funding to set up a pilot in India, run the project for 6 months, learn from it, optimize the costings, and then take the concept to the UAE. Of course, ensure that we follow all the rules and regulations of UAE and then make it a success there. I assure you, not only is this going to be a very profitable venture, it's also going to be a fantastic social exercise, and it will help hundreds of thousands of patients everywhere. So, ladies and gentlemen, that's the reason we are reaching out to you for funds. Do help out and help us change the world. Thank you.